Thank you for the opportunity to present today on AB 685 and the Cal OSHA Emergency Temporary Standards for COVID-19 Prevention. My name is Mike Wilson. I'm with Cal OSHA Research and Standards, where I've been primarily involved in the division's pandemic response. So last year, as many of you know, California struggled with the increasing pace and scale of the pandemic. And the state legislature and Governor Newsom each took action to implement legislation and regulations to protect workers from SARS-CoV-2. They both recognized that bringing the pandemic under control would require practical, meaningful, and enforceable protections for workers, especially those on the front lines. And I think the actions they took placed California in a position of national public health leadership. So today I'll go over three areas regarding these actions. I'll characterize the basic data on frontline workers in California. I'll summarize recent data on COVID-19 death rates in certain occupational groups. And I'll describe AB 685 and the new Cal OSHA COVID standards. So at a national level, about 70% of U.S. workers have jobs that are considered essential, as classified by the Department of Homeland Security and others. And a subset of about 50% of these are considered frontline workers, meaning that their jobs cannot be performed from home. And so what this graphic illustrates is essential workers with the gray bars, which you see is 69 to 75% or so, pretty consistent across the 50 states. And frontline workers represented by the yellow bars, about 50%. And California shows here 69% essential workers, 48% frontline workers. This is about 17 million workers in California. It's about 17 million workers, okay, including in agriculture. About 12 million, 69% of those are considered essential, and 8 million, which is 48%, are frontline workers. We have about 2 million workers in healthcare, in corrections and EMS and other areas that are covered by Section 5199, the Aerosol Transmissible Diseases Standard, which covers COVID-19 protections. And we have 15 million non-healthcare workers. So 48% of these 15 million workers gives us about 7 million frontline workers who fall outside the protections of 5199. And until November of last year, following unanimous approval of the new COVID standards by the Cal OSHA Standards Board, these 7 million workers were not protected by regulations specific to COVID-19. As you know, numerous agencies have worked hard to develop COVID-19 guidance documents for employers to protect workers from infection, including the CDC, Federal OSHA, CDPH, and Cal OSHA. And employers have no doubt done their best to implement these recommendations. But the State Attorney General, Javier Becerra, in his comments to the Standards Board last year, noted that, and I quote, "To date, we have found that employers have not consistently implemented these best practices and have not uniformly abided by local health orders." The data are beginning to underpin the AG's point. Dr. Yehong Chen and his colleagues at UCSF pre-released the first study of its kind last month prior to peer review, where they reported the risk ratios for excess deaths, that is observed over expected, in 8 occupational sectors, comparing pandemic time, March to October 2020, to non-pandemic time, that is January 2016 to February 2020, 4-year period, among California residents 18 to 65 years of age. And in this illustration, non-pandemic time is shown here as baseline, as the dotted red line, with a risk ratio of 1. The UCSF team found that compared to pre-pandemic years, deaths altogether in the 8 areas increased from about 20% to more than 40% during the pandemic months of March to October 2020. However, when they disaggregated these findings by each of the 8 sectors, they found that the increased deaths were driven by higher rates, I should say, in food and agriculture, in manufacturing, and in transportation and logistics, each of which exceeded a 1.5 risk ratio, or 50% increase in deaths during the pandemic compared to pre-pandemic years. Taking it a step further, when they evaluated all 8 sectors, in addition to retail, which they added to the analysis, through a race and ethnicity lens, they found an aggregate 22% increased death rate across all those 9 sectors. And when they looked more closely, they found substantial disparities based on race and ethnicity, with an 18% increased death rate among Asian workers, 28% among Black workers, shown here as a risk ratio of 1.28, 36% among Latinx, and 6% among white workers. And among these, they found very high excess death rates among Latinx food and agriculture workers of 59%, Asian healthcare workers of 40%, Black retail workers of 36%, and white food and ag workers of 16%. Dr. Chen and his co-authors concluded that, and I quote, "The study places a powerful lens on the unjust impact of the COVID-19 pandemic on mortality of working-age adults in different occupations." So how has California responded? In the middle of 2020, Assemblymember Luis Gomez-Reyes, a Democrat of San Bernardino, proposed the first elements of COVID-19 worker protections in AB 685, which was signed by Governor Newsom in September 2020. The new law requires changes in 3 areas: worker right to know, public information, and enforcement by Cal OSHA. In the area of worker right to know, AB 685 requires employers to provide written notice of potential COVID-19 exposures to their employees, to the employees' union, and to any subcontractor employers. And employers are required to retain records of these notifications for at least 3 years. It requires employers to communicate information to employees on sick leave and other benefits related to COVID-19, as well as on anti-retaliation and anti-discrimination rights, and the employer's disinfection and safety plan. It explicitly prohibits retaliation when employees report a COVID-19 test result or diagnosis. With regard to public information, AB 685 requires employers to notify the local health department within 48 hours of an outbreak, which is defined as 3 COVID-19 cases in 14 days, and to report the incident details, the company address, the industry NAICS code, and to continue notifying the local health department as new cases are identified. It requires CDPH to post the outbreak information to its website, which will allow the public and decision makers to track outbreaks by industry. And it requires the employer to retain a record of health department notifications for 3 years. Under enforcement, AB 685 clarifies existing authority of Cal OSHA to issue an order prohibiting use. specifically for COVID-19 hazards, which could result in the immediate closure of certain operations at the facility or the facility itself. It exempts Cal OSHA from the 15-day pre-citation notice requirements to employers for serious violations related to COVID-19, and it removes the employer's right to rebut a serious violation by claiming that the serious violation could not have been known. AB 685 went into effect on January 1st this year. So California is also taking administrative action to protect employers, or to protect workers. On November 19 last year, the Cal OSHA Standards Board unanimously adopted the mandatory emergency temporary standards for COVID-19 prevention under Title 8, Section 3205. And the ETS took effect November 30th and may be extended for up to 14 months. The new standard requires covered employers to implement a COVID-19 prevention program to prevent transmission in the workplace, as well as in certain types of employer-provided housing and transportation. To bring a Cal OSHA enforcement action under the new standard, local health jurisdictions can work with the local Cal OSHA enforcement unit. And that's I note that because to date, Cal OSHA hasn't typically worked very closely with local health departments, but the pandemic is changing that. And the new standard provides a clear means for collaboration between the division and local health authorities in ensuring the protection of workers within the jurisdiction of the local health department. Non-enforcement technical support for small and medium-sized employers is provided by Cal OSHA's consultation service, and I've posted the website for the regulatory text and frequently asked questions and so forth here, and I'll put that again on the final slide. So there are 5 new sections of the emergency temporary standard. 3205 is the prevention program. Point 1 has to do with multiple infections and COVID-19 outbreaks. Point 2 is major outbreaks. Point 3 has to do with employer-provided housing. And point 4 has to do with employer-provided transportation to and from work. The scope applies to all employees and places of employment, with the following exceptions: workplaces with one employee who does not have contact with other people, employees working from home, and employees covered by Section 5199, which is the aerosol transmissible diseases standard. So as I mentioned earlier, this means the new standard covers about 7 million frontline workers who cannot work from home. That's the 48% of the 15 million workers who are not in healthcare and therefore not covered by the ATD standard. This Section 3205 it follows a clear logic model, and each of the steps that I'll sort of walk through here are not necessarily taken sequentially. Some might be done simultaneously by the employer, but what I'm trying to do here is illustrate the basic logic of the standard. The regulation requires employers to communicate with their employees regarding COVID-19 hazards. It requires employers to investigate COVID-19 cases and offer testing to exposed employees. It requires that employees be excluded from the workplace with COVID-19 exposure, and it requires the employer to implement specific return to work rules. One of the core elements of the 3205 is a requirement to identify and evaluate COVID-19 hazards in the workplace, and to correct those hazards, to implement engineering controls where needed, and standard sort of administrative controls for COVID-19 prevention, as well as personal protective equipment, to train employees on COVID-19 hazards and the ways in which COVID-19 is transmitted between people, and to ensure accurate record keeping of all of these activities. 3205.1 is very similar. This covers COVID-19 outbreaks, so defined as 3 or more cases occurring over a 14-day period. In this case, the required response by the employer is similar, supplementing the ongoing requirements of 3205 with requirements to working from the left, exclude employees as needed and implement proper return to work rules, notify the local health department within 48 hours of an outbreak, and communicate with employees. In the center of the diagram, investigate the cause of the outbreak and take several actions in response to this investigation. And those are evaluating the existing company prevention policies, practices, and controls, conducting weekly testing of employees in the exposed workplace, evaluating the engineering controls, administrative controls, and PPE protections, and then implementing changes to prevent further transmission. 3205.2 applies in the event of a major outbreak, defined as 20 or more cases in 30 days, and these requirements supplement those of the previous 2 sections. The requirements for a major outbreak are similar to those of an outbreak, except that, employers must evaluate the need to stop some or all operations until COVID-19s have been corrected. And that's, as you see, directly up at 12 o'clock in the diagram. Conduct twice weekly testing for employees in the exposed workplace. Install MERV 13 filters or the highest compatible level of filtration in the HVAC system, and evaluate the need for portable HEPA filter units. Assess the need for respiratory protection improvements as required under Cal OSHA's Respiratory Protection Standard 5144. So I've covered some of the high points in the standard, but of course, in no way have provided a requisite level of detail to understand the requirements. And so I recommend those of you who are interested visit the Cal OSHA website for the standard that I will show again on the last slide, and you'll find the text there as well as a model program and frequently asked questions and so forth. So finally, the new standard contains requirements when housing or transportation is provided by the employer, which is common in California's agriculture sector. It's well recognized that due to historical structural inequities, low-wage essential workers, especially in agriculture, are more likely to live in crowded housing and more likely to depend on transportation that's provided by their employer and usually shared with many other riders. So to reduce transmission in employer-provided housing and transportation, the new standard requires employers to group workers into cohorts, beginning with family members and with workers who work together each day. And it includes sort of standard requirements pertaining to physical distancing, face coverings, hand hygiene, cleaning and disinfecting, and symptom screening, and in the case of transportation, to excluding symptomatic workers from the vehicle. In housing, testing is required in the event a worker is exposed or experiences symptoms, or when recommended by the local health department. And the employer is required to isolate cases and persons with exposure in suitable quarters. And in vehicles, there are requirements around maximizing the interior ventilation with certain caveats to that. So again, I encourage you to visit the the website and read these subsections. So I've posted the website here again, and we're also doing our best to respond to inquiries on the Cal OSHA email for research and standards noted here. I'll end with the words of Dr. Chen and our UCSF colleagues from their recent paper, which I think succinctly captures the point of this work and the work so many of you are doing. They write, and I quote, "In-person essential work is a likely venue of transmission of coronavirus infection and must be addressed through strict enforcement of health orders in workplace settings and the protection of in-person workers. If indeed these workers are essential, we must be swift and decisive in enacting measures that will treat their lives as such." So with that, again, on behalf of Cal OSHA and the Department of Industrial Relations, I want to thank you for all that you do, for your attention today, and for the opportunity to present the ways in which California is taking actions to protect our essential frontline workers and their families. Thanks again.